Samuel Dinagaran for giving a brief introduction about me. I would like to take this opportunity to thank our director, Dr. Nachiketa Raut, our deputy registrar, Dr. A. Amarnath, chairperson of Rehabilitation Council of India, member secretary of Rehabilitation Council of India, in charge for CRE at RCI, Dr. Rajesh Kumar Verma ji, Shri D.K. Pandeji and Shubham Pandeji. Thank you so much, and today we are going to, in this 40-45 minutes, I am going to share my experience on the understanding the role and responsibilities of rehabilitation professionals, particularly when we talk about professional ethics in practice of rehabilitation science. I think I am audible and quite clear enough. Can anybody say that I am audible and quite clear? Okay, yes, thank you Purnima ji, thank you so much. Okay, so next one. So when we talk about understanding the roles and responsibilities of a rehabilitation professional, it is very important for us to know what exactly or what exactly we are supposed to do as a rehabilitation professional. So the entire presentation of 40-45 minutes that today I am going to talk is basically I'm trying to provide a comprehensive understanding of the variety roles that a rehabilitation expert or a rehabilitation professional plays and how they are impacting on the care of the clients or persons with disabilities as we talk. So my content will be on these three aspects as you can see on the screen. Now before I start on the content, I want to make it clear that as per the norms and the guidelines of RCI, not only the information that we are sharing on the slides are important for your question and answers, but it is also important that whatever the expert is speaking or whatever the professional is speaking or whatever the resource person is speaking, that also should be listened to carefully, because there will be some questions from what I am speaking or maybe what all the other speakers will be speaking. So I have made the presentation into three aspects. One is on rehabilitation team members, another is on rehabilitation counselors or whatever we call them, and the rehabilitation specialist. Next one, sir. Next one. So when we talk about rehabilitation team member, that is what is my section 1, collaborative care approach, that is what I have understood, that how the roles and responsibilities of a rehabilitation professional should be, like how are we going to have a collaborative approach. Now this collaborative approach I have made it into three categories. One is optimizing client care, and another is team dynamics, and the third one is client-centered approach. So when I am talking about, as you can see in the slide also, when I am talking about optimizing the client care, what exactly I'm speaking about, or what exactly I'm trying to share is that we as rehabilitation professionals work in a variety of multidisciplinary aspects. So which includes physiotherapists, which includes occupational therapists, which includes speech therapists, which includes special educators, psychologists, clinical psychologists, and all other specialists that are basically that ensures a holistic and a comprehensive care for clients. So we all know that what multidisciplinary team in rehabilitation is essential, or why it is essential, because as we all know that it is basically providing a holistic and comprehensive care. Understand, it is basically providing a holistic and comprehensive care. So when we take all these people, when we take all these rehabilitation professionals, the unique skills they have, the skills or capabilities they have, so what we do is the perspectives of each team member, each multidisciplinary team member, it can be developed and coordinated. A coordinated care strategies can be developed, which basically optimizes the client or persons with disabilities outcomes. It reduces recovery times, it enhances the client satisfaction. So what it additionally does, it additionally the teamwork, whatever the team is there, it basically fosters is basically has a continuous learning and a professional development among whatever service providers we are. So ultimately trying to improve the overall efficiency and quality of care that we are trying to provide for our clients or to our persons with disabilities. So when we highlight the roles of these rehabilitation professionals, it is very important that these specialists, like for example physiotherapist, for example occupational therapist, other specialists, they definitely play a very distinct role, very complementary role in providing the recovery and well-being. Like for example, physiotherapist will focus on improving the physical function. Occupational therapy, on the other hand, will try to provide some independence in their daily activities. Other specialists like speech therapist, or they work on communication, they work on other speech and language aspects, while the psychologist or the clinical psychologist, they try to address the mental health issues that arise during rehabilitation. So all these professionals, they collaborate a holistic client-centered treatment plan or an intervention plan that basically addresses all the aspects of the client. So when we emphasize the goal of client care, we need to understand that there has to be a holistic and a comprehensive approach, because ultimately a holistic and comprehensive approach in rehabilitation is going to empower the clients or empower the persons with disabilities to achieve a higher level of functioning and a better quality of life. So next is team dynamics. We all know that we all have been talking about, and we all have been working in that team dynamic area. We all know how important it is, how crucial it is in a rehabilitation, because it enables the professionals to work together more closely, more effectively, wherein a proper collaborative environment and particularly each team member skills, expertise are utilized to their full potential. So the understanding of team dynamics is crucial, because it helps to minimize the conflict, it streamline the decision making process, it enhance the overall team performance and leading to improved well-being of the client and outcome. So it will provide a more supportive and efficient working environment for all the service providers. So when we talk about team dynamics, does this effective collaboration and communication within the team is helpful, or is is effective? Yes, definitely, because when we try to give a clear and respectable communication, it forms a positive team atmosphere wherein each of the members. So if we are trying to appreciate the team members, definitely what it happens that each member feels valued and supported, ultimately enhancing the team's ability to respond. Swiftly, effectively to all the needs of the clients, wherein the overall overall improvement of the client, and it becomes more effective and the client feels satisfied. So team dynamics, I'm still on team dynamics. So team dynamics, like how team dynamics contribute to the overall well-being of some of the clients, or let's say some of the people with the disabilities, because it fosters a cohesive and supportive environment. As I told earlier, it fosters a cohesive and supportive environment wherein comprehensive client-centered care is the main priority. So when healthcare professionals or when rehabilitation professionals, when they understand and effectively manage the team dynamics, they can collaborate more efficiently. They can ensure that all aspects of a client or a person with disabilities, the intervention, are well coordinated, are consistently aligned to the individual needs. So what happens, this team dynamics, this collaboration approach, it minimizes the risk of miscommunication, any sort of treatment or intervention errors that is happening, which leads to more accurate and timely interventions. So team dynamics, a well functioning team can quickly address any of the emerging issues that is happening with the client. So it can adapt to the changes in the client's condition. It can provide a holistic support that can address the physical, emotional, social aspects of the client, and also can help towards more of the client's health. The next one is the client centered, the third one. So I have talked about optimizing client care, I have talked about team dynamics, why it is important and how it is important. Now I am talking about client centered care. Client centered care, as you know, the client centered care is an approach in rehabilitation that prioritizes the individual needs, preference, values of clients, ensuring that they are actively involved in all aspects of their care. So this model emphasizes the importance of understanding the client's personal health goals, or clients providing holistic support, that comprises of physical, emotional, social and spiritual well-being. Remember that we are not talking about only these three aspects, we are also talking about the spiritual well-being of the client. As you all know that we always talk about physical, emotional, social and spiritual well-being. So when we have an open communication, when we have a collaboration, when we have a respect between the clients and the service providers, there can be a partnership that can be created. Now with this partnership, it empowers the client to make informed decisions. We all have read about informed decision, because we need to inform them about what is their treatment, how the protocol is going to be, or what type of plan of action we are going to provide to the client. So all these things, so this will be a partnership. We are partnering, we are having a bridge between the service providers and also the clients. So ultimately this approach is helping the quality of care, helping the quality of rehabilitation, helping the quality of empowerment, and it improves client satisfaction, leading to better healthcare outcomes by having interventions to the unique circumstances of each parents or each clients. Next one. Now, before we talk about the rehabilitation practice, just go back to previous slide. Back. I just want to give some example. No, next. I just want to give some example of a few example of the client-centered care in rehabilitation settings. So when we talk about client-centered rehabilitation care, for instance, in physiotherapy, or let's say in physical therapy, the therapist collaborate closely with the clients to achieve rehabilitation milestones. That is basically aligning with their recovery goals and lifestyles. Occupational therapy, they may work with clients to adapt their home environments and daily routines, so that it can enhance the independence and quality of life. Now, psychological support. Psychological support, what all can happen? It can happen like having counseling sessions that can help the client to manage stress or whatever emotional challenges the client is facing because of having a rehabilitation program. So, by integrating all these personalized approach, like you have like I have spoken about physical physiotherapy, occupational therapy, psychological, similarly for speech and language also. So when we integrate all these things, like from physiotherapy, occupational therapy, psychology, everything we are integrating, we are opening a communication. The rehabilitation team is trying to establish a supportive environment where the client will feel empowered, the client feels valued, the client is actively engaged, which leads to improved outcomes and client satisfaction. Next one. Sorry. Now the next is rehabilitation practice, as we are talking about rehabilitation, how rehabilitation is there when we practice professional ethics, and when we understand the roles and responsibilities of a rehabilitation professional. So there are again three aspects. I've mentioned, if you can see in the slide, I have mentioned three aspects: holistic evaluation, treatment planning, assistive devices. So what type of evaluations are performed by rehabilitation professionals? We all know that it is psychological, we have neuropsychological, we have vocational, we have clinical, we have special education, we have so many evaluations are performed by the rehabilitation professionals, because they conduct this evaluation to understand, comprehensively understand the needs and capability of their clients. So what does psychological evaluation focus? It focuses on emotional well-being, it focuses on coping mechanisms, it focuses on mental health status. These are crucial for understanding conditions, like for example, if the client has anxiety, which can affect or impact the rehabilitation progress. The neuropsychological evaluation, it needs to understand the client's cognitive functioning, the memory, attention, problem solving abilities, which are very vital for understanding how brain injuries or neurological conditions that affects the daily life and rehabilitation potential. The vocational aspect, the vocational evaluation, it assesses the job skills, it assesses the interest and readiness, where if the client has completed a rehabilitation program, can he or she can go back to the work, or we can provide guidance on vocational training. And career planning. Career planning is very important nowadays, because we need to understand the aspects, as a lot of opportunities and avenues are being provided. So we need to understand, and there has to be a career planning. The clinical evaluations. It consists of the entire physical assessment, the entire physical health assessment, medical history. You can have like what is the current physical status, or are there any coexisting health conditions that are there, so that we can plan a holistic treatment or intervention plan, and by considering all aspects of the client's health well-being in the rehabilitation process. So these holistic evaluations collectively inform the development of a need-based or tailored intervention plan that address the specific needs and goals of each client, and optimizing their rehabilitation outcomes. So what is our main thing is the holistic evaluation. Whatever we are doing, the aim, the responsibilities of the rehabilitation profession is to make sure that the rehabilitation outcomes are optimized. Because when we have this personalized approach, when we have this a feeling of this personalized approach, it not only enhances the treatment or the intervention efficacy, but also promotes a engagement between a client or a person with disabilities and the service provider, satisfaction, overall well-being. So this is what is important when we talk about holistic evaluation. The second part is treatment planning. We all know, like, there has to be in special education, we all know that there is an individualized educational program, because we are trying to give education to the child with disabilities or to the students with disabilities. There is a treatment plan also, because like for example, in physiotherapy or occupational therapy, we provide a treatment plan or an intervention plan. As I was talking about the clinical evaluation. See, clinical evaluation is very important. Not every time we do a special education evaluation or an evaluation in a classroom. We also do a lot of evaluations in the clinics. For example, when I sit in the clinic, I do take care of the medical history. I do take care of the developmental history. I do take care of the family dynamics, because it is very important Family dynamics is very important, as I was talking about in the team dynamics. Family dynamics, how the family is, how well the health of the family is, how the family is interacting with the client. It is very important, because ultimately what is your aim? You want them to be included in the family, and when you are including them in the family, you are making them a part of community. So when we design an individualized treatment plan, or when we design a intervention plan in rehabilitation, there has to be a systematic, collaborative process, and that will start from the evaluation, comprehensive evaluation, like physical, psychological, cognitive, vocational needs. So all these informations, the service provider or the rehabilitation professional, they take it through the medical history reviews or interviews, or as I was talking about. Now then what they do, they analyze this data, they analyze this information, that what specific areas are needed for intervention. So when the multiple disciplinary team combines or collaborates, they develop a specific plan that integrates. I'm talking about integration, I'm not talking about disintegration, I'm talking about integration of all these various therapeutic modalities, like physical therapy, physiotherapy, occupational therapy, counseling, speech and language, special education, vocational, so all these things. So remember, regular communication we have to make with the client and with their family, because we require feedback. Unless you give the feedback, we are not going to we are not going to go towards the next part. Whatever information I am sharing with the client, or whatever therapies we are giving to the client, as a responsible rehabilitation professional, we should get the feedback, because whether my therapy is correct or wrong, whether I need to improvise on that, or whether the client is having a good engagement with the therapist. So it is very important. Feedbacks should be incorporated. So so what we can say, that the intervention plan, the treatment plan is quite dynamic, because with the ongoing monitoring and adjustments based on the client's needs and changing client's progress and changing needs, so that it remains aligned with their recovery goals, and there is an optimization of the overall rehabilitation outcome. Remember that, because this is how it is important when we talk about the responsibility, the role of a rehabilitation professional. The third one, assistive devices. We all know assistive devices, like assistive devices. Now there is lot of programs government is giving, like assistive devices implementation program, and you have been provided with assistive devices, so that you can the independence and the functional capabilities of the clients are increased or enhanced. Now these devices, which includes wheelchairs, which includes walkers, prosthetic and orthotic devices, adaptive tools, teaching learning materials, they are basically what? They are basically designed to support mobility, to improve the physical function, to facilitate the performance of everyday activities. And the rehabilitation professional, the responsible rehabilitation professional, they should assess the specific needs of each client. They should assess. Without assessment, they should not provide any assistive devices to people or to the clients, because you don't know what exactly you are trying to provide them. So that is why that's your responsibility, that you need to assess the specific needs, recommend appropriate devices, and often you need to provide training on their use and maintenance. How it has to be used, how it has to be maintained, that has to be ensured, because by integrating these assistive devices in the rehabilitation process, the clients people with disabilities can achieve greater autonomy. That is what we are trying to do. Independence, reducing the risk of injury, improving the overall quality of life. So these devices not only aid in physical recovery, but also they try to boost the confidence, the self-esteem, and encourage in active participation in personal, social and vocational activities. So rehabilitation in practice, remember, holistic evaluation, treatment planning, assistive devices, and when we talk about the importance of the assessment and intervention in rehabilitation, especially during the disasters and conflict situations. So that is what is my next slide that I am going to talk. Next one, please. Very important that we talk about this aspect, because rehabilitation and disaster response. We had a very severe disaster, or what we can say, we had a very bad 2020-21 because of the COVID-19. And we all know that how all the rehabilitation professionals involved in providing a better disaster response to all persons with disabilities and all their clients. So what I have done here is I have given you three aspects: early rehabilitation and disaster response, critical role in disasters, how are you going to take care of the universal health care coverage, and what are the interdisciplinary collaboration. So when we talk about disaster, what is our role? What is the role of a rehabilitation professional in early rehabilitation conflict situation? See, conflict situations are there, and it becomes sometimes difficult to understand that how are we going to respond. So rehabilitation professionals, they definitely play a very important role, because their expertise is essential in stabilizing the clients and also preventing them from early sort of any injuries. So when we provide rapid assessment and intervention in disaster and conflict situations, we must understand that it prevents complications such as infections and chronic pain. So the importance of rapid assessment and intervention is definitely to prevent the complications like infections and other chronic pains. So when we collaborate during this emergency response aspect, the teams, they offer immediate physical, psychological and functional support, which ensures that the clients, they receive a comprehensive care in the most challenging situations. They also work on fitting and training assistive devices so that mobility and independence are restored as quickly as possible. So what we can do, what the rehabilitation professionals they do, they integrate into the early stages of disaster response, which helps them mitigate long-term disabilities, promote faster recovery and enhance the overall resilience and well-being of affected populations. When we talk about rapid assessment and intervention is basically it significantly impact the outcomes and recovery trajectories of the clients. It allows the rehabilitation professional to identify the injury, to identify the disability, and to provide immediate and appropriate care, preventing complications like infections or contractures or chronic pain, and prompt intervention. Immediate intervention helps to stabilize the client's condition, reduce the severity of impairment, and make them initiate the rehabilitation process, which is quite important for achieving the optimal functional recovery. We talk about next is universal health coverage. We all know that it is very important nowadays that health coverage or health aspect is being taken care of, not only for people with disability but for everybody. See, rehabilitation is integral to universal health coverage because it ensures that all individuals, regardless of their circumstances, should have access to comprehensive health services, because that will help them to achieve the highest possible level of functioning and quality of life. So this holistic approach of providing universal health coverage not only supports the physical and mental well-being of individuals, but also enhances their ability to participate fully in the society and workforce. Next, when we talk about integrating or working towards the interdisciplinary collaboration, we heard about multidisciplinary collaboration. Now, when we talk about interdisciplinary collaboration with various healthcare or various service care professionals, it is very vital in delivering high quality, client-centered treatment or intervention program or protocol. So we need to have specialist healthcare professionals also. Like for example, we should have doctors, we should have nurses, paramedical professionals, social workers, psychologists, clinical psychologists, special educators. Because these expertise can be pooled in and can be used for a better coordinated care plan. So when we talk about the collaborative practice, as I told earlier, it fosters a supportive environment for clients as well as the providers, wherein you are facilitating communication, you are facilitating continuity of care, holistic treatment by considering the physical, emotional, social needs of clients. So in disaster situations, there has to be a coordinated and swift response to mitigate the immediate impact on the populations which are affected. And we need to have a well organized effort or program that addresses urgently the medical needs, provides life-saving interventions, and provide further complications that happens because of health. So early rehabilitation and disaster response, I talked about critical role in disasters, universal health coverage, and interdisciplinary collaboration. Next one. Next one. Professional competence. I know I should not, I'm not that much competent to tell all those who are sitting across, because you all are competent enough. But still, when we engage in ongoing learning and development, we need to keep ourselves updated, abreast of the latest advancements in the field so that it can enhance the professional competence. So when we talk about ongoing, so professional competence, continuous professional development, the ethical practices the advocacy, the client advocacy. So the ongoing learning and development under continuous professional development is important because it maintains high standards of the intervention program or the care and adapting to the advancement in the rehabilitation practices, which also involves inclusion of technology nowadays at a more prominent level. The continuous professional development, it allows the rehabilitation professionals to acquire specialized skills in emerging areas. There are many emerging areas nowadays. I have been working on robotic technology. That is an emerging area. artificial intelligence, emerging area, neuro rehabilitation, emerging area, geriatric care, and trauma. So all these learning, ongoing learning, fosters critical thinking, problem solving abilities, innovation, enabling professionals to respond effectively to the evolving needs of clients and the healthcare and the rehabilitation intervention program. So when we invest in this professional competency or development program, the rehabilitation professionals, the rehabilitation professionals not only enhance their own expertise but also contribute to the advancing field of rehabilitation, and it overall improves the healthcare delivery system. So whenever you are attending programs like this, or any short-term training programs or any refresher programs, it is basically refreshing what you have learned in your graduation, in your post-graduation, or in your PhD or whatever higher qualification, because you are enhancing the expertise, you are upgrading yourselves. So when we stay updated with the latest advancement, we can also work more towards research and other intervention modalities that can reshape the landscape of the rehabilitation intervention program. The next one, ethical practice. When we talk about ethical practice, we have to upload the ethical standards in rehabilitation services. In rehabilitation services, it ensures integrity, it ensures safety and dignity of the clients with whom we are working. When we work on their treatment plan, so the ethical guidelines that govern the conduct of rehabilitation professionals, guiding their decisions and interaction with clients, families, colleagues, we need to adhere to the standards. They must maintain trust and confidence in their practice. If you have undergone a professional course, you must trust yourself that you can provide a proper rehabilitation program. But on the contrary, you also need to respect, promote transparency and accountability. Accountability is what? You cannot practice without having your RCI license. You must ensure that you have the RCI license. Without license, for example, I am just talking about when we have small fever, or let's say some medical issue, we go to the doctor and we see the board, we see that he is a licensed doctor. So why not we ensure that we take or we provide services wherein we are registered with the Rehabilitation Council of India. It is our responsibility. It promotes transparency. So this ethical practice, it promotes or it prioritizes the autonomy and well-being of the clients with whom you are working. So when you respect their rights, when you inform them about the treatment protocol, when you take their consent, you take also their confidence, and you respect for their cultural and personal belief. So ethical considerations, it extends to the equitable access to care, resources, advocacy. So when we uphold the ethical standards, we not only safeguard the client's welfare, we also empower them. The next one is about client advocacy. We need to act as advocates for clients by making sure that their rights, needs and interests throughout the rehabilitation program or throughout the intervention program is taken care of. We need to advocate for the policy changes that support the well-being of individuals, that support the well-being of clients or individuals with disabilities or any rehabilitation needs, professionals need to contribute towards the overall health outcomes and quality of life for their individuals. Next one. Now section 2, we are coming towards the counselors or the rehabilitation counselors that we talk about, because here we are going to discuss the process of assessing the clients and designing a treatment